statements for members, and I will recognize myself for 5 minutes. Thank you to our witnesses for being before the subcommittee today. The bills in front of us today are designed to promote greater and improve access to care for Americans and their families. They are also complementary to our work on lowering health care costs for all Americans that we've worked together bipartisan moving forward with that. We're considering legislation that will continue programs to detect, to diagnose, and to treat chronic diseases and health conditions at earlier stages, improve the quality of life for individuals with disabilities, help ensure Americans in rural communities have access to life-saving care, and provide additional resources to assist in the development of cutting-edge treatments for debilitating health conditions. Today's hearing will help inform our policy making as we explore how current programs are working and if any gaps that exist may be addressed to improve the quality of life for millions across the country. For example, my bipartisan bill, H.R. 7218, the Building Our Largest Dementia Infrastructure for Alzheimer's Reauthorization, or BOLD Act, would continue programming to ensure individuals living with Alzheimer's have access to the highest quality of health care while building on efforts to identify and diagnose the disease sooner. The BOLD Reauthorization Act also includes educational resources for caregivers to help ease the challenges for those caring for the loved ones with this vicious disease. These continued investments are even more important now that we have treatments to slow the progression of Alzheimer's and will help to ensure patients and their families have more time together. And I say that as one who just lost my mother-in-law to that disease in October. I would like to thank Representative Tonko for leading this legislation with me, and I look forward to working to get this important bill reauthorized this year. Another crucial bill we are considering today is the Charlotte Woodward Organ Transplant Discrimination Prevention Act that's led by Representatives Kamek and Dingell, which will prohibit healthcare providers and other entities from denying or restricting an individual's access to organ transplants solely on the basis of the individual's disability. This builds on work we did last week, led by Chair Rodgers, who has been a champion for individuals with disabilities by passing the Protected Healthcare for All Patients Act out of the House of Representatives to ensure individuals with disabilities are treated fairly and are able to access the treatments they need. We'll also consider the Deandra Dixon Include Project Act, which will authorize current programs at the NIH to continue cutting-edge research on Down syndrome and address gaps in current research initiatives. The Include Project will continue to facilitate improved coordination across NIH and build upon research that will improve the quality of life for those living with Down syndrome. Other bills being considered today are designed to improve access to care for individuals in rural communities, as well as diagnose potentially fatal yet treatable chronic diseases such as heart disease and certain cancers. The Siren Reauthorization Act, led by Representative David Joyce, will continue providing resources for rural emergency medical providers to ensure they can maintain their essential services. H.R. 7189 will reauthorize programs to help address gaps in care for individuals with congenital heart disease. Efforts like this have helped to ensure over 90% of kids who are diagnosed with congenital heart disease live well into adulthood. Many of the bills we're considering will promote greater access to care, facilitate earlier detection, diagnosis, and interventions, and help individuals live longer and healthier lives. Thank you to all my colleagues who have worked hard to get the legislation before us today. I appreciate all of our panelists for being before us today, and I thank everybody for their leadership and working on these policies. And I will yield